Good day, my dear postgraduate students. In fact, budding postgraduate students. My professor of pathology in JIPMER then used to say, you must be strong in your basics. Know the normal, you will identify the abnormal. We shall continue with histology for pathology, the liver and gallbladder in this class. I'm not going into the gross, but just a brief recapitulation. This is the liver and the superior surface that we are seeing. There is a right lobe and the left lobe. The caudate lobe is peeping out over here, and there is a gallbladder at the other end. Inferior vena cava could be made out, and these are the various ligaments I would like you people to kindly see. The right triangular ligament and the left triangular ligament. Basically, if your anatomical knowledge is approximate, you are excellent. This is the inferior surface. And a beautiful picture once again, the liver. And here I'm able to see the various impressions of the kidney, the stomach, the quadrate lobe over here, the caudate lobe above, and then there is a groove for the vena cava. There is something called the bare area of the liver. So this is just the anatomy. But our business is histology. Here again, I am able to see the inferior surface. There is a gallbladder from which I am able to see a cystic duct. Then there is a left and right hepatic duct. They are common to form. They join together to form the common hepatic duct and then the bile duct, which open into the ampulla of it. Obviously, I will be able to see the structures of the stomach bed, including the pancreas. And this is the stomach, the duodenum that I'm seeing. Name the structures, they are worth its weight in gold. Courtesy, Nature Reviews. Coming to our class proper, this is a normal liver. These are certain landmarks which you should identify. Let me show it to you on the screen. This is the central vein, and this is the portal triad at the other end. This is the entire hepatic lobule, but I do not find a clear line of demarcation between the adjoining or the adjacent lobules. It is not lobes. There are three zones. Initially, this used to be called one, the perivenular region. But now, the periportal region is more important. It is called as 1, the midzonal as 2, and the perivenular region as 3. What else am I seeing in this picture? I am able to make out all the pink colored ones like ribbon are the cords of hepatocytes. Cord means it is a strand which can be above 1 or 2 cells thick. Cords of or strands of hepatocytes, and they are separated by spaces called the sinusoidal spaces. That much alone I can make out. So, central vein, portal triad, radiating cords, sinusoidal spaces. So, I feel that this liver is normal. That means it has got a normal architecture. And what does the word architecture means? It is the relationship of one part of a tissue to another. The same thing is shown over here. Beautifully, it is a three-dimensional one. There is a hepatic vein, and these are the sinusoidal spaces that I'm seeing over here. And then there is a branch of the portal vein that is draining into this. These are the hepatocytes that I'm making out, and there can be the Kupffer cells, which are forming part of the lining of the venules. If this is going to be a lobule, there can be the alternate portal triads, which can be made of. OCR biology for this beautiful picture. And look at this. In fact, this is a beautiful schematic picture. The alternate angles of the hexagon is having the portal triad. Not every angle. That's a mistake that many books make. And I'm able to see the radiating cords, central hepatic vein. This is a portal triad, of course. And they are snugly or very amply placed so that there is no distortion to the. And please imagine it is a three-dimensional one, not two-dimensional as we are seeing. Again, a beautiful one. In this, actually, the picture is wrong because every angle is showing the portal triad. It should be alternate. Anyway, the cords of hepatocytes are quite good. The portal triad is well made out, and classic liver lobule is seen, courtesy Histopedia. So there is a cut surface of it. This is a gallbladder that we are interested in. And in this one, are you able to see the bundles of smooth muscle? Then there is an adventitia, there is a lumen, and into the lumen I am finding the mucosal folds. This is being reflected in this picture. So I am finding that there are the mucous folds over here. We'll see what it is composed of. There can be a lamina propria beneath that, and still below that can be the muscle layer. Thanks to nature for these pictures. This is the histology of the gallbladder. So initially I find that the mucosa is thrown into folds and they are lined by tall columnar cells. So look at this one, the inset. These are the tall columnar cells. They have got microvilli. They are not hair follicles but microvilli, not cilia. That is to improve the area of secretion or absorption. The mucosal folds. And supporting it is a loose connective tissue called the lamina propria. And these are all the mucous glands that are there. And look at this mucous gland. It is showing some inroads into the underlying tissue. So this is again the mucous gland. Columnar cells or goblet cells. Low down, I'm able to see the nuclei. Thanks to this reference. Sometimes what happens is, particularly when there is an inflammation, there is a muscle over here. It is quite thick, hypertrophied. But I'm finding that the glands are coming low down. It can be mistaken for a cancer or a carcinoma. So this is called a sinus. A sinus is nothing but a blind tract with opening at one end. So it is called as a Rokitansky ash of sinus, which can be going lower down. And this is somewhat a biliary sludge or a stone that could be made out. This is usually seen in the lumen. So there is a mucosal fold over here, and within that I am able to see the biliary sludge. The histology very well labeled. You are able to find out the columnar epithelium, mucosal folds, the lamina propria, the smooth muscle, and then the serosa. There will be the arteries, veins, etc. that are seen over here. So this is a histology of the gallbladder. We shall remember it because it is important. A very common specimen that we shall be seeing. Again, a beautiful one. I would like you people to kindly identify and describe it on your own. All the names are given over here, but there should be a play of words. For example, the mucosa is thrown into folds. It is lined by columnar cells, and the nuclei are somewhat basal. I am able to see the microvilli at the tip. They are all supported by the lamina propria. Such a flow will come to you once you people start talking. In fact, you must develop a verbal diarrhea. I would like you people again to describe this. So, there is a central vein. There are the radiating cords of hepatocytes. They are somewhat polygonal or hexagonal. And the nuclei, these are all the nuclei. They are vesicular. Mild variation can be seen. And this is the sinusoidal space. This again, I leave it to you people to describe. But do not waste this beautiful picture. Identity was partly heritage and partly upbringing, but mostly the choices you make in life. Now that you have made a choice of pathology, pathology is your life. Mercy.